In this video, we will review Pronation Distortion Syndrome and its effects on the kinetic chain and corrective solutions to decrease injury risk. Pronation Distortion Syndrome is characterized by excessive foot pronation associated with knee internal rotation and adduction. This lower extremity distortion pattern can lead to a chain reaction of muscle imbalances throughout the kinetic chain, leading to foot and ankle, knee, hip, and low back pain. Static postural analysis. In the anterior view, we notice that she has a slight knee valgus with both knees caving in. We also notice that she has a slight forward lean in the lateral view and slightly everted feet in the posterior view. Transitional and dynamic movement assessment of the overhead squat. In the anterior view, we notice that her knees move inward. This may suggest that she has an overactive adductor complex, short head of the bicep femoris, TFL and vastus lateralis, as well as an overactive lateral gastrocnemius. Some probable underactive or lengthened muscles are medial hamstring complex, glute med and max, as well as underactive anterior and posterior tibialis. In the lateral view, we notice that she has an excessive forward lean in her lumbopelvic hip complex. Some probable overactive or shortened muscles are the soleus, gastrocnemius, hip flexor complex, and shortened abdominal complex. Her anterior tibialis and gluteus maximus may be underactive, as well as intrinsic core stabilizers. In the posterior view, we get a better look at her foot pronation. Her feet flatten, which may suggest that she has an overactive lateral gastrocnemius, short head of the bicep femoris, and her TFL. Her anterior and posterior tibialis may be weak, as well as the medial gastroc and glute med. Range of motion assessments. In this assessment of the foot and ankle, the gastroc, soleus, and posterior tibialis are being assessed. With a value of 12 degrees, we notice that she has a limited range of motion in dorsiflexion. Again, this suggests that her anterior tibialis is underactive and has an overactive gastroc. This measurement is typically restricted in a person who demonstrates foot compensations, like her flattened feet, and an excessive forward lean during the overhead squat assessment. In this assessment of the internal rotation of the iliofemoral joint, the piriformis, hip external rotators, and adductor magnus are being assessed. With a value of 52 degrees, she has an increased range of motion at this joint. This suggests that she has an overactive glute medius and a TFL assisted by the adductor complex. This measurement may be increased in a person who demonstrates knee valgus during the overhead squat. Manual muscle testing. The strength of the anterior tibialis was assessed. She received a score of 2 out of 6, indicating that she has a poor level of strength. This was expected because this muscle may be weak in a person who demonstrates excessive pronation of the feet during the overhead squat assessment. It may also appear weak at the end range if there is limited dorsiflexion in range of motion tests. The strength of the gluteus maximus was also assessed. She received a score of 3 out of 6, indicating that she has a fair level of strength. This was expected because this muscle may be weak in a person who demonstrates feet flattening and knees moving inward during the overhead squat assessment. Corrective exercise training, the inhibit stage. Because the gastroc is overactive, we will want to foam roll it. One set for a duration of 30 seconds will be completed, with more focus on the lateral part and holding it on the tender spot. The adductors will also be foam rolled. These shortened muscles will need to have tension release for 30 seconds and have a slight hold on the tender spot. Finally, the TFL and IT band will be rolled. This will release tension that is causing the knee valgus. Corrective exercise training, the lengthen stage. The gastroc will be stretched with more focus on the lateral part. She will stand near a wall with one foot in front of the other and the front knee bent. The back heel will be kept on the ground as she leans towards the wall. This stretch will be held for 20 to 30 seconds. Standing in the same position, she will drop her back knee to get more of a soleus stretch. This stretch will be held for 20 to 30 seconds. We will then go into a standing adductor stretch. She will start by standing with her feet about 3 feet apart. She will shift her weight to the one side and allow the knee to bend. The opposite knee will be kept straight to feel the stretch on the adductors. This stretch will be held for 20 to 30 seconds and will be repeated on the opposite side. Corrective exercise training activation stage. The resisted dorsiflexion exercise will be executed for isolated strengthening of the anterior tibialis. A resistance band will be placed around the superior part of her foot. She will begin with her foot in plantar flexion and will then flex her foot by pulling her toes towards her. There will be a slight pause and then return to the starting position. The hamstring cable curl will be completed for isolated strengthening of the hamstring complex with the focus on medial activation. This exercise can be completed by lying prone on the floor or on a bench. An ankle cuff will be attached with a pulley in a low position. The weight will be selected and she will begin the exercise with her leg fully extended. She will then flex her knee and bring her ankles towards her glutes. There will be a slight pause and then the weight will be lowered slowly and controlled back to the starting position. Lastly, the ball bridge will be completed for isolated strengthening of the glute max. She will begin by resting her head and shoulders on the ball with her knees bent at a 90-degree angle. She will then press her hips up towards the ceiling with a focus on glute activation. There will be a slight pause and then she will lower her hips down to the starting position. Corrective exercise training, integration stage. We will finish the corrective exercise training with lateral tube walking. A resistance band will be placed around and slightly above her knees. She will do 10 yards of a side step going each way. This exercise will focus on keeping space between her knees and activation of all the lengthened muscles within the Pronation Distortion Syndrome.